Welcome back. So you're getting a dental implant and you're not quite sure what all that means and what's involved in the process. Hi, I'm Dr. Langston. I'm a prosthodontist in Atlanta. Been practicing since 2005 and I'm the owner of Dental Implant and Aesthetic Specialists.
I'm Dr. Miro, and I've been practicing here since August of 21.
So stay tuned to the end to make sure you find out the most important thing to make your implant treatment successful.
Step number one.
So the first step is coming in and meeting us and letting us perform a comprehensive medical and dental evaluation. This allows us to learn your health history, to make sure you're a suitable candidate for implants, and also to kind of go over all the treatment plans, whether it ranges from single tooth implants to multiple implants to removable appliances to full mouth cases. There's a lot of options that we could have to utilize implants. The running joke is if you ask 10 dentists for your opinion, you're going to get 11 different opinions. And so we need to make sure when you come in and meet us that we should plan a custom tailored plan just for you and make sure it's right for your mouth. Step two.
If we determine that you are a good candidate for implants, the next step is to get a CBCT. The CBCT allows us to see the quantity and quality of bone. This is really important because we want to make sure that when we place an implant, it has stability. Another reason why the CBCT is important is because it allows us to plan out on our computers exactly where we are going to place this implant. This is not just important from a surgical aspect, but also from a restorative. We're able to do these surgeries three-dimensionally guided.
Yeah, the neat thing is a lot of planning goes into these cases. So from the beginning co-beam, we can work with our lab technician, work with our restorative plan, and figure out a way to build your ideal restoration kind of from the top down. So we know that once we get into the surgery, we know exactly where that implant needs to be placed. And we know exactly the final restoration that's going to go on top. All right. So step three is the actual day of implant surgery.
We finally made it to the day where you get to have your implant placed. This day is really important, and a lot of patients have a lot of questions about that day. For the day of surgery, we have a lot of different options so the patient feels relaxed. The first option is nitrous.
Nitrous is a great option because it allows you to relax and kind of take the jitters and the nervousness out and allows the whole process to start smoothly.
The next option is IV sedation. This process is a little bit more involved. For instance, if you are being sedated, you'll have to go through a medical screening. In addition, you'll need to come with a driver, and we'll have to make sure that you haven't eaten anything 12 hours prior to the procedure. Regardless of whether you choose nitrous or IV sedation, we will always use local anesthetic. This gets you numb in the area to assure that you don't have any pain or sensation throughout the entirety of the procedure. Another option we have here for our patients is PRO. This is when we draw the patient's own blood and we spin it down in a centrifuge. This gives us the ability to draw all the good things in your blood, the white blood cells, the platelets. It is proven that with this, healing of 4 weeks is equivalent to 1 week. In essence, it speeds up the recovery process tremendously, allowing you to get back to your life and your daily activities faster. Whether it's sedation, nitrous, or just local anesthetic, the next step is the actual placement of the implant. The first thing we do is we place the surgical guide on the patient. The surgical guide is what allows us to make sure we are placing the implant in the perfect location that we pre-planned for. After this, we use our dental instruments to surgically place the dental implant. We'll let your implant heal for about 3 months. During these 3 months, we give the implant the ability to osseointegrate. It molds into your bone so it gets that stability it needs for Dr. Langston to place your crown. After the implant is placed, you'll usually get 1 to 2 stitches just to make sure that tissue closes over perfectly.
And once Dr. Miro is done with the hard part, I get to come in with the fun part and usually put a tooth on top. There are lots of different ways to restore an implant the day of surgery. If we're able to plan ahead and the bone quality is great and we can put an actual tooth on there, a temporary tooth, we can do that. That's not that common. Usually what happens is Dr. Miro has to close the tissue over and we have either a flipper or a temporary partial. It's essentially a fake tooth that goes in and kind of camouflages and make it looks like your tooth is there. And you're going to wear this for a good 3 to 6 months while you're healing. It serves a very important purpose. It protects the tissue. It looks nice, and it allows you to function and go out in society while your implant is healing kind of behind the scenes. So if you've had any aha moments or have any questions or concerns, make sure you subscribe to our channel.
Step 4.
So step four is the healing phase. And when you think of a healing from an implant placement, it's not a active healing where you're hobbling around or you're not able to do the things that you would normally do. The first couple of days you're going to be a little sore. It's going to be a little tender. But with the flipper in there to protect everything, you'll be able to go back to normal eating and talking. chewing, singing in church, whatever you want to do. And basically, behind the scenes, what's happening is that implant is placed and the new bone cells actually grow onto the surface and really lock it into place. And so that's why we have to wait at least 3 to 4 months, depending on how strong that bone was the day of surgery, before we can start the process of putting the tooth on top. Step number 5.
After we've left enough time, 3 to 6 months, for that implant to integrate to that bone and gain that stability we need, you'll come in to see me and we'll place a healing abutment. When you come in for this procedure, we'll go ahead and get you nice and numb so that you can't feel anything. Then we'll make a tiny little incision and we'll gain access to that implant. After that, we'll place the healing abutment. The healing abutment is what will hold that tissue, just spread it a little bit so that Dr. Langston can go ahead and make that crown for you. Step number 6.
So this is when it's finally time to start the process of making the tooth that you've been waiting for so long. So you'll come in, and since Dr. Miro has already got the tissue out of the way, we'll remove that into a healing abutment. We'll put what's called an impression post in there. We'll take an impression of your top teeth, your bottom teeth, a bite registration, and make sure that when we build this crown on top, it fits perfectly into your mouth. I'll put that healing piece back on, and then we'll send everything off to the lab. And my lab technician and I will sit down and we'll design your crown from the implant surface all the way to fill all the spaces. So when we get that final tooth, you've got good contacts on the adjacent teeth and it fits into your bite. What's an impression? An impression is essentially a mouthful of goo that we put in there that will give us an exact mold of your mouth that shows us the orientation and angulation of that implant so that we can build the crown to fit those exact proportions. But this was just a brief summary of coming in and seeing us and allowing us to restore a single implant. There's lots of options and a multitude of treatment plans with implants, from single teeth to multiple teeth to all your teeth. So make sure you subscribe below and follow us for more videos and all the different treatment options we have for dental implants. A cough, this teeth.
Let me show you how to put this back together.
I might do that. That won't happen in real life.